Buenas tardes. Yo esperaba una presentación, perdónenme, porque estaba esperando algún tipo de intervención y me he confundido. Por eso ha habido este minuto, estos segundos de silencio.
English today.
Alfonso, por favor, preséntanos.
Yeah, no, but remember, today is in English. Tomorrow is in Spanish.
¿Perdón?
Today is in English, tomorrow in Spanish.
It's English, sorry, it's English. Thank you, you reminded it. Please, will you... you see how I am? This is my mental deterioration, which when you have two languages and you're able to communicate more or less the same way in both languages, these things happen. Today is in English. It's a Wednesday, the second Wednesday of this month of March, and it's we have an appointment. We have 1 hour or the time you want to talk about our job, our profession, being a medical translator or interpreter. That's why we have this Dr. Mugüerza's clinic. I am Pablo Mugüerza, and I'm very honored and pleasure to be here today to try to increase the communication among translators and to also to widen your perspective of the profession and to give you a very close approach to our job, to the practical side of our job. You won't listen, you won't hear in this presentation, this broadcasting, you will not listen to theories of translation, which are very necessary and are very interesting, but this is not the place for them. This is for those of us who are working every single day, translating words and every day accounting. And, we have always, today we have 2,000 words and we have 10,000 words for the week or whatever. That's what we do here. Let me start saying thank you, a very huge thank you to translators. As you see in the screen, translators.com is the company which is in charge of all the technical aspects of this broadcasting, and Alfonso, who has been there, is the CEO of translators. So thank you to Alfonso Bartolesis in particular, but I know he's the head of the team, and I cannot say all the names here, but I am really in depth with them, and I want to say thank you, and I will do it always, because to me it's a great opportunity to be able to be here with you, just as a doctor, playing as a doctor, to try, as I told you, to clear the way among all the difficulties of medical translation. Let me take a second to get away from this presentation and say that today is the International Day of the Woman. So congratulations to all women. This job, our job, is particularly feminine, right? You know that most translators are women, that most interpreters are women, and that's very, for me, it's wonderful, because I'm really a feminist, and I really would like to see a world where men and women would have the same rights. That doesn't happen currently, and but the message I would like to convey to you about this particular point of the International Day of the Woman of women is that with a wide perspective, if you analyze history, how it is going. I will be 60 years old next September, so I've been 60 years on this planet, and what I've seen is that things have changed enormously and wonderfully in a positive way. Most of course, the world is still much more difficult for women than for men. It's we have to fight for that, to change that. But I can see that in a few generations, probably, there's a possibility that this equality is achieved. We have to celebrate that today, and to be very aware of the huge work still needed, but with the hope that maybe in 2-3 generations things will improve, at least in a few countries. That's all we can say at Enlightened Optimism. Do you know this book? I don't know if you know this book. It's Enlightenment Now by Steven Pinker. Steven Pinker is, it's a reference in our job as translators, as linguists, linguist professionals. Steven Pinker, Enlightenment Now, a wonderful book which presented me with the concept of enlightened optimism, which is, if you look at history with enough perspective, you will always have an opportunity for optimism. That doesn't mean that we are stupid and we don't see the problems. We enlightened optimistics. No, we are not. We know, but we know history well, and we realize that things improve, things go better. We're in the middle of a war. We don't know what will happen, but that's the short term. That's what is going on right now. So get back now to our presentation. Let's go to let you know. Let me send you another message. The first one has been the International Women's Day. Congratulations, felicidades a todas las mujeres. That was in Spanish. Sorry. The second message is that this broadcasting we're releasing every second Tuesday of the month, every month. We will do that in April, in May, June, and the second Tuesday in English, the second Wednesday in Spanish can be sponsored. If you have a product, a medical translation related product or medical interpretation related product, and you want to sponsor us, be somewhere in the screen, or you want me to talk about your product, just let's talk, and I'll see the product, and if I can see this is useful, I will show it here and let present that to a huge audience. We started with a small audience. Today it's higher, and it has to grow, of course, and I'm sure it's growing. That today we'll have more people than the other day, even more people than the other day. We had a lot of people in English. We had a lot more in Spanish. Please. Spread the message, spread the word, and let people come to join us to this small chat, where you can, of course, see. I have opened the chat. I see so many people from Barcelona, from Mexico. I love Mexico. I really love Mexico. And StreamYard. So two messages today. Remember, first of all, well, 3 messages. Pablo is not well in his head, and he started to speak Spanish today. Second message, congratulations to all women. Third message, please contact translators if you want to promote, sponsor, or show your products in our broadcasting. You can be in one of the corners here. I can show you the product, and it's a wonderful way to keep connected with laboratories. I don't know, maybe you're a CRO and that you want us to, I don't know, participate somehow or make advertise your webinars. The main CROs in the world are broadcasting webinars, wonderful webinars, and I don't think they have a lot of audience, but we can help them by showing them here and talking about them or whatever you're interested in can be here. And you can, of course, sponsor us, and you will be our sponsor for 1 week or 2 weeks or what you want. And that's something I wanted to tell to you first. And let's go with the pills for today. Compartir, share the screen, and here we go. As you know, this broadcasting consists of basically of a small pill every session, chapter, as Alfonso prefers. At every chapter, we will have a small pill, a medical translation pill, every second Tuesday of the month. Today is the second Tuesday of March, and the next will be on April the 12th. Please. Write it on your agenda, keep it with the record, and we will see each other again next April the 12th. But today we have a pill that maybe if you've seen the advertising of this session, you probably know you were talking about the difference between study and trial and the translation of pain. That will take us just 15 minutes, just in case. So if you have questions, if you have about the pills or about anything about related anything related to the job, to our job, our profession, being medical or translator or interpreter, please write it on the chat, and I will try to answer, and we can establish a conversation and try to keep this alive, right? So this is my first spiel for today. We don't concede it all, but I think don't worry, I will show it. I will show it to you somehow. As you can see there, that's these two words. You have had this problem. Maybe you have experienced enough, and you think, "Well, this is so easy for me." But there's a lot of people who is still doubting all the time when they are facing the translation of medical texts, and they thank you, Alfonso. Thank you for just for a minute. Take a capture of the screen now. Do it now before all the publicity, all the letters are on the screen again. Take a capture now, and then you study it slowly. Today's pill is double, as I told you. First, we'll talk about study and trial, and then the translation of pain. Here you have the difference between study and trial. The difference is very easy, both in English and in Spanish. A study is any kind of investigation. Even if it's not scientific, you can call it a study. You can just, I don't know, you're studying how my children are behaving after lunch, for instance, and you want to do something serious, and you take notes and you analyze what happens after lunch with your children. That's a study. It's a very wide concept, and it is a hyperonym, as you can read there. Yes, you can read there hyperonym there. And hyperonym is, as you know, probably as a linguist, is the wide term when you have smaller ones. For instance, you have the hyperonym animal, and you have the hyponym elephant, for instance. So the hyperonym here is a study. It's a large concept. Everything, whenever a person decides to analyze or make a detailed examination of a given organism, object, or phenomenon. Your children after lunch is also a phenomenon, probably. That's a study, a very wide term. So that's the difference with a trial. A trial is a type of a study. You have lots of types of trials, as you can see there. You can see it here. The type of studies, you have cohort studies, case control studies, cross-sectional studies, qualitative studies. But the main classification of studies is into two groups. Studies may be observational, and interventional. Intervention, also called intervention studies or interventional studies. Observational studies are supposed to be studies where you only observe. You don't alter at all. You don't affect. You don't impact what is going on with what you are investigating. You don't impact that. You're only observing, and those are called observational studies, right? It's not true that, from my point of view, it's almost impossible to make an observational study, because you know that whenever you just set a machine watching, or you're watching a population or a sample of a population, you change it and you impact there just by watching. Think of a group of patients and in a study for obesity, or for gaining weight, right? Gaining weight, and say, we will only observe you. You stay as you do your normal life. We will not give you a drug. We will not give you training or sports, nothing. Just do your normal life, and we will be observing you and drawing conclusion after 1 or 2 years of studying. That would be an observational study. You know that a percentage of that population will try to eat less, go more to the gym, doing things which are reading more books. I don't know if they are being observed. Even that's a human, right? So that happens in all sides of nature. And whenever you observe something, you are always altering, impacting what you observe. If you introduce a camera in the forest, and you say, well, this is just to see the birds, and then nothing is changing. The things change. Those are observational studies. The other type of studies, intervention studies, where a human being intervenes and impacts the population. Those are the clinical trials, right? So a trial is a type of study where there's some human intervention. You have there a small definition here. An intervention study is a specific type of clinical research study that aims to answer a defined question about a treatment and its hyponym. So the difference is very clear. If all trials are studies, not all studies are trials. That's very clear. Study is the wide. There is another term here that may interfere, which is the term experiment. You have it there, experiment, which is definition. The definition is a set of operations to discover, verify, or demonstrate some facts of general principle. But the truth, now that you know the elements, that you know the difference between study, trial, experiment, what you will face when you work, when you open your computer and you start translating about the studies or trials or experiments, is what you find at the end of this table. In the field of research, of course, in the field of clinical or medical research, the terms trial, study, and experiment often overlap and are frequently used, depending on the context, as if they were synonyms. That's our problem as translators, that most writers use them as synonyms. So you will find in your text, and if you're not very sure what they're talking about, you will find in your text in English that they are talking about trials, studies, and experiments. And they may be meaning the same thing all the time, or they may not. And you have to know that. You have to analyze your text and reach the conclusion and guess if they make a difference between these three terms. Most of the times, only two of the terms, clinical, trial, and study. But you have to understand that if you study clinical trials and clinical studies, if you go to books about clinical trials, which is, you have books from the 50s to here, the 50s of the last century, you will find that most authors at some point will say, you know what, in my book, I will use the trial and study as synonyms, or trial and experiment and study as synonyms. That's what they do. That's what happens most of the time. So my rule for you today, my appeal today, is when you are translating, follow the writer's decisions. When they use study, you translate to the term in your language. In Spanish, is estudio. When you find a study, you translate estudio. When you find a trial, you translate ensayo, or the term corresponding in French or in Italian, or the language you translate into. And when you read experiment, you can translate by experimento, which is a not very advisable term in Spanish, for instance, because experimento is loaded with prejudices about, where Dr. Jekyll, something that's an experiment, and it's not a good term for patients to write for patients. Experimento in Spanish, that's what I'm saying. So remember, study is a wide term. All trials are studies. Not all the studies are trials. There are other types of studies. Most of the times, when I say most, I mean 99% of the time of the time, you will find that the author in English is using them as synonyms. So all you have to do is to convey that into your language, and to say study, studio, etude, I don't know, in other languages. Today is not my day for languages, as you have seen. Study by the corresponding term, trial by the corresponding term, and experiment by the corresponding term, unless there's a clear will of the writer saying, in my text, trial means this, and study means this, and experiment means this, because you will find all the definitions you want for each of these terms when you when you do surface on the internet. So that's all I wanted to say to the first part of the pill of today. I hope I've made clear my idea that the difference between these three terms is usually inexistent, right? Most writers use them as synonyms. So don't worry, just follow them, and when they use study, look for a term for studying your language, and so on with trial and with experiment. That's regarding study and trial, which was a promise we made for the first chapter. Is it only my connection, which is super bad? I think it's only your connection, Jack Murgek. No complaints here. Let's go now to the second part of today's pill. And you have here a little advice. I think it will be helpful for you to know about the translation of pain. You are if you do medical translation, you will face sooner or later terms related to pain, and it's difficult to translate. All I can do here is to give you the definitions in English, in good English. What do they mean? The most used terms. What do they mean in English? If you understand my definitions today, you will be able to translate them properly. But remember, when something is so common in a population like pain, everybody has a pain. Maybe a pain in the ass, maybe a pain in the heart, but maybe in the heart, and that's not exactly a pain when you're talking about sentimental pain, right? So everybody has a pain. When that happens, when everybody is involved with a term, the language offers hundreds of possibilities of translation, and it's very difficult to translate. And that happens with pain. Let me show you my second pill of today. Let's go to these four terms you can see here: pain, tenderness, tender, ache, and sore. When you have an unpleasant sensory and emotional experience associated with actual or potential tissue damage and conveyed in many cases through the nociceptive afferent system. This is when there's pain in your hands or in your knee or in your foot or in your stomach, and it through the afferent system, nociceptive afferent system, reaches your brain, and you get that information. It is pain. I have pain there. That's the widest term of all, pain. That's what we call pain. But when this feeling is not spontaneous, I mean, you have a finger and your finger, and you have a pain there. You can feel it. You can feel it spontaneously. That's a pain. But when it is not spontaneous, you have to touch. You have to touch it or to feel the clothes on it, and then you feel the pain. That's tender. That's tenderness. A pain elicited by palpation or by contact. Let's say by contact with that. That's the difference with the pain and tenderness. There's another term for pain in English. That's ache. You have it there. We call it ache or dull pain. Dull pain, we translate it, if you listen to the translation into Spanish, we say dolor sordo, which means a deaf pain. It's a pain who cannot hear, right? And that's the translation of ache and dull pain. The particularity of this term ache is that it is used for head, back, ear, tooth, and stomach pains. Only for those. You can say you have a headache, a backache, an earache, a toothache, and a stomach ache. But in principle, it wouldn't be correct to say you have a knee ache, for instance. People say it, of course, but the theory is this one, and you have to know the theory and then adapt it to the practical aspects. Another characteristic of ache, I'm thinking of it as a kind of pain, right? Another characteristic of ache is that it is usually fixed and continuous. As well as for aches, pains or dulls, vague or not very severe pains. Not very severe pains, when they are not very severe, maybe it's not in head, back, ear, tooth, or stomach, but it's not very severe. Let's say we can say there that it is an ache. So pain, what we call pain, right? It's a sensory and emotional experience. Sensory and emotional. You have your pain when there is injury, tissue injury, but also when you lose, when someone you love dies, you have pain. That's also pain. And in all the languages, in Spain, it's also dolor. That's pain, the more general term. When you have to elicit it by contact or by palpation, then we call it tender. My finger is tender, or I have tenderness in my finger, right? It's usually used for abdominal pains, that you have to touch there, and then the patients complain, oh, it hurts there, it hurts. Okay, that's an ache, that's a tender, that's tenderness in your abdomen. Then you have ache, which is used only for these 5 parts of your body: head, back, ear, tooth, and stomach, and also and it's usually fixed and continuous. And then you have another term, which is sore, which is a diffuse and often burning in nature pain. When you can point to the pain, you can say, my pain is here, or as people with a heart attack would say, my pain is here. They here, so they point with their finger. There's a specific point, and that's a pain. When the pain is more diffuse, and just like here, or it's not, or maybe it's general pain. There's people with disorders who have bodily pain, and that's a sore. That's diffuse and often burning. When you are talking about burning in the nature pain, probably it is sore. These are the 4 most important terms here: pain, tender, ache, and sore. But starting from here, you can have all varieties of definitions, and many times you will be translating verbatim statements from the patient, what the patient said, how the patient described the pain, and that is very local. I cannot help here from here. I can help in the Spanish translation of the types of pain, but if you translate that, when you are talking about how patients describe their pains, and even how doctors describe the pains of their patients, they use very specific, very local terms, very everyday terms that are not in the books many times, because people use their words to express the pain. Pay attention when translating about pain, that you have the prefixes algo, the prefixes algo, the prefix alg, and the suffix agia, as you can see in those terms in algoporania. I think that more or less the pronunciation, when something has this prefix algo, and that means pain. For here, let me say first that probably that when doctors talk about among them, when they write for scientific purposes, they are writing in a kind of Greek. It's all the time all Greek. It has provided, it has reached our times, and it's there. And when you used very technical terms in English, you're using usually Greek terms. For instance, in algopareunia, this term here, that means painful coitus. People who have a painful coitus. The man or the woman, usually the woman, and it's called algopareunia. When you see this prefix algo or alg, like I don't know, another other. I can think of other examples now. It means pain there, and also the suffix algia, like neuralgia, arthralgia. I don't. You can think of many. That means, in this case, arthralgia, pain in your joints, right? Because arthros is also Greek for joints. So if you talk about translating of pain, you have to mention this prefix and suffix. Also, the prefix odino and the suffix odinia. When you say odinophagia, this is odinophagia is pain when swallowing. Pain with swallowing. Phagos, also Greek. Phagos is swallowing or eating in a way. And odino is the prefix, mean pain also. And the suffix odinia, like in mastodynia, that's pain in the breast for in the woman's usually in woman's breast. Mast is another that is Latin. I don't know. But you have the prefix mastodynia. Note that I'm reading the final message there. Note that English-speaking patients usually distinguish clearly between it is sore, meaning diffuse and often burning in nature. It is painful, which is more localized and well-defined pain, and it aches. It's all again diffuse but dull in nature, usually dull in nature. This difference is not burning, it's dull. That's all the difference I can bring to you today. So it's fascinating, this question of translating pain. And this is the end. I think you can bring back all the all we have in this screen if you're there, Alfonso, and also if you have questions, it's probably you will have questions. I hope you have. It's at the moment now to make them. Thank you. I will just finish this presentation, but telling you at the end. I will tell you this at the end. Okay, here I am. Let's go with the questions. If you have anyone. Great effort. I haven't seen. Well, if you don't have questions, that means that I've made myself clear. I can tell you more about. By the way, let me tell you that all the information you have seen on the screens have been taken from two books. From two, not exactly books. It's what we used to call books. One of them is the dictionary of medical translation that is called like that, Diccionario de Dificultades, Dudas y Dificultades de Traducción Médica del Inglés al Español, by Fernando Navarro. You know that professionally our reference is in a website called www.cosnautas.com, and there you have the dictionaries where I've taken all this information, most of the information. The rest is taken from another dictionary which is free. Cosnautas is you have to pay to access to the dictionaries, but the other one is the Diccionario de Términos Médicos, which is a dictionary only in Spanish. It's very useful. They have also the English voices, the English translation of the terms. It's very useful. It's very easy to find on the internet. Thank you, dtm.ranm.s, and it's free. It's very useful. It's very good, and it's also very good to practice your Spanish in case you need it, because it's very well written. And of course, it has the participation of Fernando Navarro there. All the information you've seen there today about pain and about study and trial, most of it has been taken from these two sources, which I would say in most of our translations are enough. If you are considering a career as a medical translator or interpreter, and you say, well, I will need a lot of dictionaries, because no, most of what you need is there. Of course, these days I'm working in a translation about intraocular lenses. The ones they will give you if you have cataracts in your eye. Then they will take your a lens, your anatomical lens out. It's been destroyed, right? They will take it out and change it with a artificial intraocular lens. And of course, if you go to that specific field, maybe you don't find that in these dictionaries. But for most translations, for protocols, for informed consent forms, for summary of product characteristics, investigator brochures, all these kind of documents that you translate every day, all you need as a professionally is Cosnautas and the DTM. Thank you to you, Daria Timova. Where are you? My God. Thank you to you for that's what I can do. I think that what I can do if you compare me with other people who speak on the internet, is that I'm clear about I try to be clear about my explanations, because I've been many years with dealing with them, and I've dealt with them for many years, and I'm sort of used. I don't see your question, so what I will do is I will try to give you another pill, right? While you still can make questions in the chat, let's go for another pill. Here you have now you don't need to take anything away from here, Alfonso, because it's here. The difference between severe and serious, that's important. Maybe in English you don't have the problem as clearly as we have it in Spanish, because we have, very similar words to the English ones. We have, for severe, we have severo, and for serious, we have serio. And usually they are not the right translations for severe or for serious. Take into account these little tips I have written here, also based on Cosnautas and the DTM. Let me see it, huge. And first of all, you see here that severe is related to intensity. You have to think first when you read that a pain, a disease, a cancer, a traumatism is severe, that you look and think that it's intense. You don't know if it will be dangerous for the patient yet, dangerous for its life, for his or her life, for their life, or if it will be terrible for their kidney or for their stomach. That's different. All you know when you hear or read that a pain or a traumatism or a disease is severe, is that it is intense. Also, as you know, some diseases can be extremely intense and not be serious. Think of people with headaches, migraine. Think about people with migraine. If you probably you have a relative, usually a woman, unfortunately, but they have migraines. When they have migraine, these people can't live. They have a terrible, terrible headache, which forces them to get locked down in a room, close all the windows, no noises, no light, because any stimulus is terribly painful for them. And that lasts 24 hours, 2 days, 3 days, and then goes with, as far as we know, no consequences for your body or for your head. So it is terribly intense, but it is not serious. I think that the difference is there. You have to understand the difference between being intense, severe. You can apply this to the pain that we have seen before. You can apply that to pain. If they say I have a severe pain, you don't have to judge that it is serious. You have to only think it's intense. Okay, it's intense. Now, let's see what's serious. Serious is related to seriousness, and it is a state of being very bad. It's not so. Maybe, of course, if you have a lot of pain, you are very bad. But serious means something else. There is someone's opinion involved. When you say that the problem is serious, probably the doctor's opinion, not the best opinion on this, but probably the patient. it's something really bad here. It's not only that I have pain, no, it's something really bad inside me, and you know that, you have that feeling. But on the other hand, doctors say it's serious. It's not severe or intense. The problem is serious. Classically, a disease, a condition, a pain, whatever, is serious if it threatens the patient's life or the organ function. If you have your liver and you have a problem which is impacting the function of the liver and will probably involve having to take the liver out, or having to do something, a difficult intervention with the liver problem, then, with this opinion of the doctor saying that the life of the patient is serious, is threatened, or the function of the organ is threatened, that is serious, grave in Spanish. There's a trend, a huge trend of among translators. I edit many translations, I proofread many translations, I edit, revise, whatever you want to call it. And what you see is that the trend is to translate always severe as grave in Spanish, which is not it may be grave, but the first idea which has to come to your brain when you read intense in English is when you read severe in English is intensity only, not grave. It may be grave, right? It may be intense, but not necessarily serious. That's severe, intense, but not necessarily serious. Generally applied to symptoms and signs. That's the second translation. I told you, when you are translating severe, the term severe, the first thing which comes to your head usually is grave in Spanish, and that's not right. The first option is intense. There's a problem with the intensity of the pain or the disease or the condition, wherever. That should be the first option. And now you consider, you go to your text, you go to the glossary, you go to your client's instructions, and you see what you have to do. Is it intense, or is it grave, as you have here in Spanish? When severe is applied to diseases, injuries, and conditions or situations, then we can call it grave in Spanish. Grave in French, en français, and I don't know in other languages. But that's still talking about the translation of severe, right? It can be serious or intense. Serious or intense. That's for severe, right? What serious is only serious, right? Serious is always serious. When it is serious, you say a serious adverse event. You're talking about a type of adverse event. But severe has these two possibilities. As I told you, most of you translate severe by grave in Spanish and the corresponding term in English. My third pill today, is that is wrong, and the wrong attitude. And what should come first to your mind when translating severe is intenso. Okay, and you're talking about the intensity of the pain, and you're talking about that. But you see there that applied is usually when applied to symptoms and signs. Symptoms are subjective and signs are subjective. Well, we'll talk about that another day. So what you read then, surprisingly, what you find in a medical text is that severity can be mild, moderate, or severe. The graduation of severity is a little bit shocking. It's kind of mild, moderate, or severe. How severe is this pain? It's severe. The answer in English is that. And try to make a difference with that in your language, in the way that you can say intenso, leve, moderado, or intenso in Spanish, or the corresponding terms in other languages. But as you can read at the bottom of this table, due to the pressure of English, the improper use of severo in all meanings of severe in English is widespread in Spanish in practice. You will, if you're in the United States now, you're in Mexico, you're in many Spanish-speaking countries, you were thinking while I talked. But We say severo. I translate severe by severo. There is a traumatismo craneoencefálico severo. There were patients with heridas severas, and it's common for you, and that's how you talk in your country. Go ahead. You need, and it's compulsory. This you professionally you are obliged to know very well this difference I've tried to explain between severe, which is related to intensity, only intensity. You are not giving an opinion of what will happen with the patient, if there's a risk for the patient's life or for organs function. You're not talking about that. You're only saying that the pain is intense. Maybe it's serious or not. And they call it severe in English. So, here again. Thank you. I see many thank you, many thank you, many thank yous, but I don't see your questions. And so let's go ahead. Let's go on. Our next appointment, in case you are so kind to join us again, will be on April the 12th. At April the 12th. That's 2 days before my dad becomes 89, if everything goes right. How could you translate into Spanish poor, as in poor sleep, in terms of quality of sleep? In a patient leaflet, it says one of the symptoms of lung COVID is poor sleep. Of course, thank you for your question, Reyes Pusca. Thank you for your question. Duerme mal. One of the symptoms of lung COVID is que los pacientes duermen mal. This is a very interesting question because in English, when you're talking about a symptom, the opposite to good is poor. You don't say the patient has a rich sleep. You don't say that, but just she sleeps very well. Sleeps very well, but they say they have I have a poor quality of sleep and poor sleep, as in the question here. The translation into Spanish, which is what Reyes Pusca is asking for, that is duermen mal. Uno de los síntomas del COVID persistente, que es how you call long COVID, long COVID, uno de los síntomas del COVID es que los pacientes duermen mal o las dificultades para dormir. This is very interesting also because in English they talk about sleep and occasionally they mean staying sleeping and occasionally they mean when you go to sleep. Have you problems for sleeping, for instance? Have you any problems for sleeping? The patient may answer, yes, I have difficulties when I go to bed. I try to get slept. It's hard for me. It takes me a lot of time. And they are talking about poor quality of sleep. And then there's another completely different concept, which is the patient who has no difficulty to get slept, but then their sleep is also poor, and they get awoken at 3 or 4 in the morning and they cannot sleep again. So this is a very good question because it mixes the concept of poor applied to a symptom in medical English and the problem with the sleep. In English, it's not always very clear where is the problem for the patient. Getting slept, going to bed, and start sleeping, or when the problem is that you go to bed and get slept and then awake and cannot sleep well. Daria Artemova, thank you very much. Everything perfectly clear, no questions so far. I should be worse presenter because that way we would have questions, and I would like very much to have questions from you. But listen, if you have to know that although they are only here, translators, this is the company which is offering the best courses in the market probably today for learning about translation and communication and translation. They are made, the courses made by linguists for people who love languages and who are devoted to those. So if you want to keep in touch with us and you want to know about the professional activity of translators, please visit their website, translators.com, and you have all the information, a myriad of courses, of boot camps, lots of activities you can join or not. We have free activities and also paid activities, and you will find them. But if you want to follow me personally, for any reason, you can visit my website, Pablo Mugüerza, pablomugüerza.com, without the umlaut, without the umlaut and the U. You can follow me on Twitter. Listen, let me just say a little thing about the social networks. The social networks, right? Twitter is wonderful for medical translators. We have made a net there. We are all connected. Our translators are connected there, and we talk about our job, and we ask our comrades, our colleagues. We ask our colleagues our problems with computers, with taxes, with organizing your company, being an entrepreneur, and that's in Twitter. You don't have to follow me or follow anyone you like Fernando Navarro, or the DTM or Cosnautas. Or you follow them and you start making part of this net, and it's wonderful. It works perfectly. I know you probably have said, I don't like Twitter. It's so much hate there and so much problems and people insulting and using. That doesn't happen in our environment. We help each other, and it's wonderful to be there. Please have a professional account in Twitter. And if you want, also, I can offer you our Facebook wall. I don't know, maybe you don't like Facebook because of the privacy issues, but still, it's a wonderful opportunity to learn. We have this Traducción Médica Aplicada, which is a Facebook wall that I administer. And I work a lot on it every single day, and you have a lot of information of new uses of terms, of technology, science, medicine, languages, of course, sometimes a bit of humor, and people goes to this Facebook wall to make their questions about, I don't know, today there was a girl who wrote to me. She wanted to know about how to find maybe a database of informed consent forms. She wanted that, and I said, well, I don't know, I can't help you, but try in our wall, and I think they have helped her. But you can also ask about, I don't know how to translate that. Can you help me with this translation? Is anyone ready for an interpretation tomorrow in Malaga, or I don't know, in Barcelona, or in those parts of the world which are in real trouble now? So that's all for today. Thank you for not making questions, because that means that I've been clear enough. I hope that from today on, you won't have a problem with the study and trial and the possibility of experiment. I hope I've made a clear difference between those terms. Also, how to translate pain. Remember, the problem of translating pain is that it's so common that a local language always will have a myriad of possibilities of translation. So you have to have very clear the concepts I presented you in the table today, and then apply that to the target language. And we also talked about severe and serious. I hope everything is clear. Remember that you can sponsor us, or you can show our product. We will have, I'm almost sure that in the next release, the next broadcasting, we will have some product to show to you, and we will have maybe a raffle if we have time for it, and we will have always surprises and new things to show you. Please join us next April the 12th at 4 p.m. CET, and I'll be here with you. So that's all for today. I don't know if anyone is going to talk. I don't know, or it's only it's only me saying farewell. Thank you for attending, and like it said here, thanks for attending, and uh, problems. And thank you for attending. It's been a pleasure. See you next April the 12th. Thank you, Valeria de Grande. It's always a pleasure. Thank you. Thank you. It's always a pleasure to do it. Goodbye. Have a nice evening.